Hello everyone. Today I am going to talk about one of the most important disease in the history of humankind, that is tuberculosis. Tuberculosis, a disease which infects millions and millions of people worldwide every year. It was Robert Koch, the scientist, who discovered that Mycobacterium tuberculi is the organism which causes tuberculosis. Tuberculosis is a multi-system infection. That means it can infect different organs, which includes primarily lungs, brain, eyes, intestine, bone, skin, etc. When we look at the burden of tuberculosis worldwide, it can be seen that the occurrence of tuberculosis is highest in the developing nations and lesser in developed nations. India, China and Russia are the countries which has got maximum number of multi-drug resistant tuberculosis. In terms of absolute numbers of tuberculosis infection, India has the highest number of cases. When we look at the top 10 causes of death worldwide, especially due to infectious diseases, tuberculosis remains one among the top 10 causes of death in the whole world. Tuberculosis can be classified based on the location of the infection or the organ affected into pulmonary and extrapulmonary tuberculosis. Tuberculosis is a disease which primarily affects the lung. That is why we have a separate classification called as pulmonary tuberculosis. So any TB infection affecting lung or tracheobronchial tree is known as pulmonary tuberculosis. TB infection occurring in any other part of the body is known as extrapulmonary tuberculosis. This can include pleura or pericardium, lymph node, abdomen, genitourinary tract, skin, joints, bones, meninges, etc. So, whenever TB infection occurs in other parts of the body other than lung, it is known as extrapulmonary tuberculosis. Secondly, TB can be classified into bacteriologically confirmed TB and clinical tuberculosis. When a patient with symptoms and signs of tuberculosis comes to the doctor, and he will be sent for certain investigation in order to diagnose tuberculosis. When the laboratory confirmation comes and they find that in that patient's sputum or bodily fluid, Mycobacterium has been found, that case is called as bacteriologically confirmed case of tuberculosis. When a patient comes with signs and symptoms of TB and all the tests are negative for TB, you have ruled out all other diagnoses, still the patient has got signs and symptoms confirming TB, that case is known as clinically confirmed tuberculosis. Third classification is based upon drug resistance. When a tuberculosis patient shows resistance to any of the one anti-TB drugs, it is called as monoresistance. When a patient shows resistance to more than one anti-TB drug, he is called as polydrug resistant TB. When a patient shows drug resistance to rifampicin and isoniazid, both are anti-TB drugs. When a patient shows resistance to both isoniazid and rifampicin, that patient is called as multi-drug resistance TB. There's one more drug resistance TB called as extensive drug resistance TB. This is a case which shows resistance to rifampicin and isoniazid. Along with that, any of the fluoroquinolones such as ofloxacin or levofloxacin. In addition to that, there is also resistance to any of the second line injectables such as kanamycin, capreomycin. So, when a patient shows resistance to all these four classes of drugs, that patient will be called as extensive drug resistant TB. Now let's look at the symptoms shown by a patient with pulmonary tuberculosis. Most common symptoms seen in a patient with pulmonary tuberculosis is cough. Cough can be dry or with expectoration. There can be blood-stained sputum. Along with that, accompanying symptoms such as fever, night sweats, weight loss, chest pain, shortness of breath. These are the other symptoms which can be found in a case of pulmonary tuberculosis. Extrapulmonary tuberculosis symptoms depend upon the site of tuberculosis or Mycobacterium tuberculi infection. If a patient has got TB lymphadenitis, that patient will have enlarged cervical lymph node with or without discharging sinuses. If the patient has got pleural TB, patient might only have shortness of breath with chest pain, pleuritic chest pain. Bone and spinal TB patient will have symptoms such as fever, pain, swelling, backache, especially when the TB affects the spinal cord, and also deformity of the joints in tuberculosis. TB meningitis patients will show signs of raised intracranial tension such as irritability, headache, vomiting, fever, neck stiffness, etc. Renal and genitourinary TB patients may show symptoms such as painless hematuria or sterile pyuria and also infertility. So these are the symptoms which can occur in a case of extrapulmonary tuberculosis. Symptoms depend upon the location or the site of TB infection. Now let's look at certain epidemiological factors of tuberculosis. First, agent factors. Mycobacterium tuberculosis is the agent which causes tuberculosis, pulmonary as well as extrapulmonary tuberculosis. There are different strains of Mycobacterium tuberculi. There are Mycobacterium tuberculi which are found in humans, and there are also those strains which are found in bovine or cattle. So cattle strain can be transmitted to humans when humans consume milk contaminated with Mycobacterium tuberculi. But when we boil the milk, all the microbes are dead or killed. Because of this, it is unlikely that infection can be transmitted from cattle to humans. Mycobacterium tuberculi is a facultative intracellular parasite. Host factors. Tuberculosis occurs in all ages, but mostly it occurs in productive age group or middle ages. Males are more commonly affected than females. Tuberculosis has a close association with nutritional status of the person. Patients with tuberculosis are usually undernourished. When we look at the global burden of tuberculosis in the whole world, we can see that the countries which has got highest poverty has got highest number of cases of tuberculosis, and the countries which has got less poverty has got lesser number of tuberculosis cases. Tuberculosis has got a close association with poor housing, overcrowding in the dwelling, smoking cigarette, alcoholism, poverty, poor education. To sum up, TB has got a direct linkage with standard of living of a person. So when a person has got these social factors, that means he is more likely to get tuberculosis infection. The mode of transmission of TB is droplet infection. When a person with pulmonary tuberculosis coughs or sneezes, there will be droplets formed in the air which has got mycobacterium in it. When another person comes close to this patient or breathes the air which he has coughed or sneezes, he will get the mycobacterium in his body through inhalation. Incubation period of tuberculosis varies from weeks to months to years. It is very difficult to control tuberculosis. In India itself, we have achieved a lot for control of tuberculosis. When we look at the figures, the prevalence as well as the incidence of tuberculosis has gradually decreased over the period of time because of the control measures taken in the country. In order to control tuberculosis, we can broadly classify the components of control of tuberculosis into curative aspect and preventive aspect. Curative aspect includes case finding and treatment, and preventive aspect includes BCG vaccination for children and isoniazid prophylaxis in order to prevent tuberculosis. Let's start with curative aspect. So early case detection and treatment. When a patient with pulmonary tuberculosis is undiagnosed or untreated, he can go on to infect others also throughout the period when he is undiagnosed or untreated. In order to control the burden of TB, we have to find these cases as early as possible and treat them as early as possible so that this person does not give infection to others. In order to find these cases, we have certain diagnostic modalities in which the most important one is sputum microscopy. Two samples of sputum is taken. One is known as morning sample, second one is known as spot sample. These two samples are stained using Zn stain or Ziehl-Neelsen stain and visualized under the microscope. If mycobacterium is present in the sputum, the patient will be called as sputum positive pulmonary tuberculosis. Sputum microscopy can be done using light microscopy in which Zn stain is used. It can also be done using fluorescent microscopy in which LED is used and Oremann's chain is used to chain the mycobacterium. Fluorescent microscopy with LED is better and faster than light microscopy, but it is little more expensive than light microscopy. Second modality is chest X-ray. Chest X-ray features can be found in pulmonary tuberculosis as well as extrapulmonary tuberculosis. In the case of pulmonary tuberculosis, findings such as cavity, especially in the right upper lobe, can be found. In cases of extrapulmonary tuberculosis such as pleural TB, pleural effusion can be found. Epicardial effusion can be found in TB pericarditis. So not just pulmonary tuberculosis, X-ray can also diagnose extrapulmonary tuberculosis. When we do a complete blood count of a patient with tuberculosis, we can see findings such as lymphocytosis, anemia or decrease in hemoglobin content, and also increase in ESR. These are the findings which can be found in a complete blood count of a patient with tuberculosis. Next one is sputum culture. There are different mediums which are used to do sputum culture. Mediums such as LJ medium or Lowenstein-Jensen medium can be used for solid culture. Liquid culture mediums, example is Middlebrook broth medium. When it is difficult to diagnose tuberculosis with sputum microscopy, we can send this sputum for a culture. So it takes around 4 weeks in order to get the result of sputum culture. Similarly, we can also know if the patient is a drug resistant tuberculosis by culture and sensitivity test. In order to know the drug sensitivity by culture methods, it takes another 4 more weeks in order to get the results. So sputum culture and drug sensitivity is a time consuming test. That is one of the disadvantage of this method. We also require higher laboratory facilities in order to do sputum culture. Other methods of sputum culture include microcolony detection on solid media, radiometric backtech, MGIT 960, etc. There are certain genotypic methods or molecular methods in order to diagnose Mycobacterium tuberculosis. We take a sample of sputum and send it to laboratory. From the laboratory, certain tests are done in order to find genetic material of Mycobacterium tuberculosis. If genetic material of Mycobacterium tuberculosis is present in the sputum, that means that patient is sputum positive tuberculosis patient. Different genotypic methods are there, which includes PCR test or polymerase chain reaction, TMA or transcription mediated amplification. The most important one are CBNAT and GeneXpert. So CBNAT is a second generation PCR method in order to diagnose tuberculosis. The CBNAT expansion is cartridge based nucleic acid amplification test. So using this CBNAT, we can know if the patient is positive for Mycobacterium tuberculosis. Along with that, this test also tell us if the patient has got multi-drug resistant TB or not. Especially resistance to rifampicin can be found out through this test. The machine is little expensive, but this gives much quicker results when compared to sputum culture. Here we can get the results within 2 to 4 hours period of time. Next is tuberculin test. This is also known as Mantoux test. Tuberculin test is a test which is used to conduct surveys in order to know the prevalence of infection in a population. Usually, Mantoux test is not a good method in order to diagnose TB disease. The Mantoux test can only tell us that whether this person has any evidence of past or present infection by Mycobacterium tuberculosis. In India, we use tuberculin strength of 1 TU for a standard Mantoux test. In this test, 0.1 ml of 1 TU protein parts derivative is intradermally injected on the flexor surface of left forearm. This is injected midway between elbow and wrist. So after this injection is given, the result is read after 48 to 96 hours. Usually it is after 72 hours. So after 72 hours, the site of injection is inspected for certain reaction. We can find erythema and induration at the site of injection after 72 hours. If the induration and erythema size is more than 10 millimeter, it is said that this patient is tuberculin test positive. This just says that this patient had present or past infection with Mycobacterium tuberculosis. If the reading is between 6 to 9 millimeter, this result is said to be doubtful. If the reading is less than 5 millimeter, the result is said to be negative. The reading is usually done using a transparent scale or a tape. Usually tuberculin test is not done in order to diagnose a case of tuberculosis. It is usually done in order to do population based studies in order to find out the prevalence of tuberculosis. But in cases where we are not able to diagnose TB with other tests, especially in children, we can go for Mantoux test in order to diagnose TB in children. In order to diagnose extrapulmonary tuberculosis, different tests are available such as FNAC or fine needle aspiration cytology and excision biopsy. Here histopathological examination is done. Other tests include fluid flow cytology, biochemical analysis, smear examination, X-ray of the involved region, ultrasonography or USG especially for abdominal tuberculosis, CT scan, culture for mycobacterium tuberculosis, etc. These are the tests which are done in order to diagnose extrapulmonary tuberculosis. Test which is done for extrapulmonary tuberculosis depend upon the site of the infection. So these are the diagnostic tests which can be used in order to diagnose tuberculosis. So that's all for this video. In order to know about treatment of tuberculosis, you can watch the next video. So if you have liked this video, kindly like and share this video and subscribe to our YouTube channel Mu Academy, and also like our Facebook page. Thank you very much and have a good day.